Okay, our topic today is, as you're all aware of, children do get sick. Children do get sick 8 to 10 to 12 times a year in between the age of 0 to 6. So we have a whole lot of basic immunizations in these little children, and we have 97%, we all know that, viral infections. What can we do? Wait and see. 7 days without medicine, a week with medicine. Antibiotics, we will return to that topic later on. It's usually a very bad idea, and I will tell you some thought. You can use secretolytics, but secretolytics don't shorten the disease. They might lose up the mucus over the daytime, but they don't shorten the disease. And they are help you over the day, but they don't help you at night, because at night it might even produce more cough. And so the child is not sleeping, and of course if the child is not sleeping, the parents are not sleeping, everybody's looking bad in the morning. Immunostimulants, you can give immunostimulants ahead of the season, or if the child has the first symptoms, or you have the first symptoms of your viral disease, you might take Kaloban, and this is what I would like to show you, that it might be a good idea to do so, because there's evidence, and there's real good evidence with basic research and with placebo-controlled trials. This next slide shows you the mode of action. First of all, what is known? This is the basic research, Berlin, Freiburg. First of all, if Kaloban is around, the beating frequency of your cilia is faster. It decreases from 8 to 12 up to 12 to 15. So the clearance in your system goes faster. So the bacterial adhesion I just showed you is diminished. On the other hand side, the virus replication, if in the system Kaloban is around, then you are upregulated with your cytokines, you're upregulated with the interference, and so on. So the virus replication is also diminished. The invasion is not totally off, but the virus replication is diminished. And the eating cells, the phagocytosis and the oxidative burst, the killing of the germs invading you, it's increased. And at the very end, what the patient is feeling is that you all know, when you have the viral infection, you feel something is coming, sore throat, I feel a little bit chilly at that day. If you feel this, and if you notice that your nose starts running, and if you take the medicine, what the patient is feeling, and I will show it to you within the next 5 minutes, is that if they take the medicine, that the disease shortens. They feel better after 48 hours. Respiratory tract infection and ENT infections in children are more severe, they are very sick, they have a special anatomy, etc., etc. And you should make your choice very careful. They have a higher risk of complication. I showed you the pneumonias, sinusitis in the elderly, like the 6-year-old and bigger. They are sicker, they run a higher fever, so you might even lower the fever with that drug, because they get healthier a little bit quicker, because you have immunomodulator. It's working from different actions. And the parents stay at home. The children stay away from school or kindergarten. Of course, all of these diseases are self-limiting, but if you can cut some complications, some admissions to the hospitals, and if you could take stress from the parents and the family, it's probably a good idea to do so. And it works. And it is, if you look into the literature, it's the most well-researched cough and cold medicine in the world. If you look in all these other things, it's symptomatic relief, it works. Taking taking codeine, taking aspirin, taking decongestives, and so on. It works. It's symptoms reliever. Of course, it works. It helps you. You can combine it with this, but this works from a totally different direction. It works to give your body a kick to come up faster.